Thank you very much. Good morning, everyone. Thank you for joining us today on our monthly user group call. From GHA, we have Bill Wiley, the Senior Vice President of Business Operations, Sharifa Navos, our Data Integrity Specialist, and I am Leslie Stainovich, Senior Director of our Data Services, and we will get started. We have a brief agenda today, so if you are thinking of questions or things that you would like to see demonstrated, please feel free to chime in when we have that opportunity. We welcome your feedback and welcome your input. So with that, we will get started. You may have noticed that we sent out a different looking invitation this month, and this will be the ongoing look for the user group invitation. We have been, over the last probably year and a half, implementing a new customer service database here at GHA, and it has the capability of distributing emails and making it a little bit easier for us to send mass emails out. So this is our new look for the user group and for other communications that we will be sending you, other invitations. As always, I'm going to give a very brief overview of what the Georgia Discharge Data System is. However, I will go ahead and preface this by saying that we are not going to go over verification and edit summary reports today. We have actually placed a couple of recordings of those on a YouTube channel, and in a few moments, Sharifa Navos is going to show us where those are located, and recordings of this meeting as well, so that we're not being overly repetitive on these monthly calls and respectful of everyone's time. So the Georgia Discharge Data System is the data program that we manage here at GHA. Hospitals submit their data to our vendor, Heidi, in the UB04 format. It is taken in to their system, and many data checks and queries are run on that data to validate it and verify it. There are codes that are assigned, geographical codes, DRGs are assigned to that data that then becomes the Georgia Discharge Data System. GHA then submits that data on the hospital's behalf to the Brain and Spinal Trust Fund Commission, to the state of Georgia, and to the Agency for Healthcare Research and Quality and the Healthcare Cost and Utilization Project. These entities manage any research data requests that are submitted, and they vet them thoroughly, and then they give them to us to vet before any research request is approved, and that's all de-identified information, just for your information. Here is a snapshot of our schedule that we have for 2019. We are actively working on reviewing the 2018 data. I think somebody may be having audio issues. Can everyone hear me okay? I should have asked that at the beginning.
Yeah, excuse me, loud and clear here.
Okay, that's Bill from GHA. Is there anyone else on the call? Can everybody hear me okay?
I can hear you.
Yes, we can.
Thank you very much for acknowledging. I just had somebody in the text that asked if people were having audio issues, so I don't think it's from the conference line, but I apologize if you're having an issue. Anyway, this is our data schedule. Again, we are asking that you or your team, people on your team, review the 2018 data submission. We will be working diligently to close that data mid-July so that we can release the 2018 database in its final state in August. So if you have questions about the best way to go about reviewing your data, please don't hesitate to call myself or Sharifa. We'll be happy to walk you through that. But that is a very important task right now. We are continuing with our monthly data submission, which is going very well, and updating the data on the website quarterly. At this time, we're going to talk some about data services, user group resources for you. And I'm going to attempt to turn this over to Sharifa. So give me just a moment. and then Sharif is going to just give a little bit of a live presentation on how to beef up our webpage, the GHA website, so that everything you need is at your fingertips there, as far as forms, recordings of this webinar, the member folders. So, Sharif, if you could share your screen.
Can you see it, or should I?
At this time, I cannot see it, but what might be easier is let me
Can you guide me to where? Is it a button at the bottom? Okay, wait.
I'll take it back, and let me share mine again, and I'll do the demonstration. You just tell me where you would like for me to go.
Okay.
All right, so what we'll do is, let me go to the GHA webpage. And briefly, you do have to have a login for this. It's very easy to register and have a login, and I'm already logged in. But you can go to our data page.
Yeah, you would go to the Georgia Discharge Data System, and that is, and we've revamped the website to make it, I guess, more user-friendly for our members and to put more resources on there. So we do recommend you get a login because, you know, you are a member, and you should have access to all this. And so you'll see buttons here for member reports, which we discussed, and I don't know if we're going to discuss what they are today, but they, you know, that's where you'll find like your economic impact report.
Yeah, we'll go over that in just a moment.
Okay. And then also your data services resources, which Leslie mentioned, and that's where you'll find information about the monthly submission schedule. You'll have limited data set order form and the readmission order form. So any order form that you need to get access to any of our tools, you can find there. Also the notes to the study, and I'll be posting the Q4 2018 this week. And so those are basically an overview or a review of the data for each quarter, and we will be posting it there, I guess quarterly, so that you can see just an overview of the data and how it looked and the distribution volumes and stuff like that. There's also a PDF of the presentation, so from our user group meeting. So this meeting, we'll put the PDF version of the PowerPoint there. Just for those who missed it, or if you need to refer to something that you heard on the call. And like Leslie said, we'll also have the recording, and we'll show you where that is, just so that you can have a reference. So back to the page. So again, you would hover over data, go to Georgia Discharge Data System. We just added a link there in blue where it says GHA hosts a monthly strategic planning user group meeting as a resource for hospitals. And here's the link, and you can click on that to view past meetings from this year. And then also a snippet, the first video you see there is the data submission and verification. That's usually the portion that I cover, showing you how to review your data on the HeidiNet website for those of you who have access. So I think this is very useful on those videos. You can listen to them, have your colleagues look at them for, training or informational purposes. So we just started doing that, so we should have more videos and more resources. And if you'd like to see anything on there, just let us know, email us, and we'll see what we can either post as a document or as a video. And then also you have the link to the Heidi portal, so that's HeidiNet. That's the website, as you can see here, that we use that our data uploaders use to upload the data. So the link is there for you, and then also the link to our new strategic planning module, and that's JVON, and so as you can see, you can log in from there. So from our website, we're trying to make everything easily accessible for our users, And again, if you have any suggestions on other things that we can put on there, feel free. And this is for the member files, which there is the orange button at the top for those of you who have access to your hospital's member files or member folders.
Any questions about accessing information on the website? All right, so we'll be adding content to the website and different recordings and some educational little snippets of how to, run an out-migration report, or how to, some how-to videos of how to use the visualization tool as well. I did want to mention in the member reports that we're looking at here, we'll go back just so you can see how to get to those. These member reports we've discussed over the last few calls, and not everyone has access to this, and if you need access, contact Sharifa and she can help you get authorization to receive access to this. But a lot of these reports we are putting, like the economic impact report is in there, but the finance policy quality folders contain contain policy modeling for you that we subscribe to. The Hospital Association of New York State DataGen produces these reports, sends us a big file, and we divide it up by hospital and put these specific reports in your folder for you. And Bill wanted me to mention to you that there are some upcoming reports in May that will be published, so be on the lookout for those. Bill, do you want to highlight any of those reports that are going to be published?
Yeah, I can just point out several of those. The big ones that are coming out are obviously the inpatient prospective payment proposed rule. There's been a lot of activity around that this last week, since CMS has actually proposed a fix to the wage index and how that is applied. So that's going to be a big one for folks to look at, as also making sure that that wage data is going to be accurate as possible. So be on the lookout for both of those. I think that's going to have a pretty significant impact. We're actually modeling about a $14.8 million impact to Georgia with some of the proposed rule changes for the inpatient PPS. Hopefully we'll have that in the next week or two. And
when you, if you have access to that folder, you will receive a notification that looks similar to the data services with the banner at the top that'll provide you with a description and a link to the folder with the reports in it. So you will be notified when those reports are published. And along with talking about those specific reports, we hosted a webinar along with DataGen back last week about the value-based purchasing program, and they spoke to how to interpret this report, how to read it, how to understand it, and what Georgia looks like. It was Georgia specific. So we had about 50 people on that call, and we are hosting, and we did record this call, and so if you're interested in the link, please let me know. I'll be happy to forward that on to you, and we are going to try to post that on the website as well. But we have another upcoming webinar in this series that DataGen is going to co-host with us. This one will be on the readmission reduction and hospital-acquired condition program analyses for Georgia hospitals. The learning objectives are here as far as what you can expect to get out of this webinar. And again, the target audience for that will be the hospital's finance, reimbursement, and quality staff. So we will be sending out that registration link later today to users. So please be on the lookout for that. And if you don't receive it and you're interested, please let us know. As I mentioned as well, we have, I think on our previous call, we were in the process of posting these, but the annual economic impact report has been placed in the member folders. It also has been, released to the public, or released to hospitals for them to make their own press releases. So please know that that's available. Bill, do you have any more comment on the economic impact report?
No, we've seen that it has gotten some attention in local papers. So there is a template press release. Feel free to use that, and hopefully you can generate some positive publicity for your facilities. Thank
you. Well, at this time, like I said, we have a short agenda today. I do want to remind you that we have launched the readmission analytics tool. You have to have a separate approval and login for that tool, because that data is only your hospital's data, and you are able to drill down to the patient level. So it's highly sensitive, and so those forms are available in the data resources folder. We request that your CEO be very deliberate in identifying the appropriate personnel at the hospital to be users. So that's the first form, is the CEO identifying who should be authorized users on that platform. And then once the CEO has identified those people or that person, then we will send a user acknowledgement form to those people as well, and we will get a user ID set up for you. So that is, in the initial stages of usage, we're getting feedback from hospitals, from users on their findings. I believe we're getting really good responses from that. I did want to mention also that the strategic planning tool, the Javion-driven strategic planning tool, has been updated with the Q4 2018 data. So that should be, it's not the final 2018 data, but the Q4 is the most recent data that is available there now. Are there any questions or any other topics of discussion that you would like to cover today? All right, well, I think that was a long enough uncomfortable pause for everyone. If you don't have anything, that is fine. I know we are all busy, and also another reminder, we will be sending out the 2019 limited data set order form in the next week or two, so be on the lookout for that if you are interested in the limited data set. The limited data set is the patient-level de-identified statewide data. It is a subscription on an annual basis. It is inpatient and outpatient data. There is no requirement. It's completely optional. It is for an additional fee. So if you have any questions about that, don't hesitate to give us a call, and we can go over that limited data set with you. Our next meeting is scheduled for June the 5th, and we will try to, we're trying to ask you how you're using the Javion visualization tool. We would really appreciate it if we had a couple of volunteers to maybe give a demonstration of how you're using the tool, just a quick either live demonstration or send me a few slides and I'll be happy to present it. But we feel like some peer-to-peer conversation on how you're using the tool might be helpful to others. So I ask you to think about that and send that to me or to Sharifa. The last call for feedback or questions. If not, we will give you back most of the hour, and thank you so much for calling in today, and we will look forward to speaking with you soon. Have a great day.
This conference has concluded. You can disconnect. Thank you.